It's my pleasure to share with you a recent event that we undertook at Weill Cornell. I'm certainly not an expert in interprofessional education, but I'm definitely an enthusiast. And together with my colleagues from the School of Pharmacy, we had a wonderful afternoon, and I'd like to share with you the results of our afternoon and the students' perceptions as well. So it's going to be a fast trip. I'm going to use lots of photos, so hang in there. Thank you. I'm going to start by introducing you to all the participants. We had 60 students, 40 medical students and 20 pharmacy students. And our medical students welcomed the pharmacists at the entrance of the medical school. And we had a nice big group photo before embarking upon our interprofessional learning. And I cannot start the presentation without thanking each and every member of the team who has played a very important role in making the event possible and also my presentation today. So thank you. So I have to say thanks to all the presenters this morning. They've made my job very easy by talking about the importance of interprofessional learning and how innovative it is. And I don't think any of us will disagree with the fact that to take care of patients, we have to bring together effectively the expertise of multiple healthcare professionals. And as a result of that, more and more health professions education schools are engaging in interprofessional learning to be able to accommodate the healthcare professionals more effectively. As one of the presenters earlier today defined the interprofessional education as per WHO, it is when two or more professional groups learn with each other, from each other, and about each other at the same learning event. And the aim is to improve collaboration and quality of care. And this is what we aim to do. So we've heard a bit about the history of interprofessional education in Qatar, and thanks to the Qatar consortium and the research grants, some shared competency documents were put together. And most recently, there's actually an interprofessional education committee that's hosted and chaired by the School of Pharmacy at Qatar University. And sitting on this committee are members representing each and every school of health professions education in Qatar. And the goal of this committee is try to introduce and encourage as much as possible interprofessional learning across all the healthcare disciplines in the pre-licensure period. And this year I was fortunate to be able to engage our medical students with the pharmacy students at the following event. So here we go. On the day in November, in the afternoon, after we had welcomed all our students, my colleague, Dr. Kerry Wilbur, who's the professor of pharmacy, and I set off the afternoon by telling our students the goals of the day. And here you have the 60 students sitting and listening attentively. And thanks to the competency document produced by Dr. Brad Johnson and et al., we were able to select 4 competencies that we were aiming to cover during our workshop. And these are clarification of professional roles, interprofessional communication, patient-centered care, and shared decision-making. So what we did, we divided the students into mixed groups. We had 12 small groups. We gave them a brief vignette, and each of these vignettes were about 2 different diabetic patients. And we gave them some clear instructions. First, they had to read the vignette and among themselves decide what was important for them to find out about this patient and who was going to do what and what were their roles. After they had decided that, then they would have the opportunity to talk to the patient, who was actually a simulated patient trained for the story. So they're busy clarifying their roles, who's going to do what, and who's going to take the lead. And in the background, we had a team of our wonderful simulated patients preparing for the event. When the time was right, each group had a simulated patient who stepped into the room and spent 10 minutes with the group of students being interviewed and sharing their story with the participants. Once the 10 minutes was up, the students basically had to gather their thoughts together, decide what it was that were the issues with regards to the patient's needs, what were the healthcare priorities, and then afterwards we invited them to come back and sit as groups and essentially debate what they thought were the important care plan for the patient. And we had a facilitator, we had different facilitators for the various groups. A very animated exercise, and that basically brought us to the conclusion of the event. So, what was our study aiming to achieve? We wanted to know from our participants whether they had any prior experience with interprofessional learning. If so, what it was. What were their attitudes with regards to interprofessional learning, both prior to the event and also at the conclusion of the event. We wanted to know how would they prefer to do this IPE learning, and if so, would they like it to be assessed or not. The methodology was essentially, there's a validated tool called the Ripples tool, which is Readiness for Interprofessional Learning, and we offered it to all our students at the beginning of the event and again at the conclusion of the event. Now, attendance to the event was mandatory, but filling in of the questionnaire was voluntary. And obviously, we were able to get ethical approval for our project. A few words about the Ripples survey instrument. It was developed in 1999 by Parcel and Bly, and it was validated by them and has also been validated in the Gulf countries in 2006 by Professor El Zubair. What does it ask? Well, it explores the demographics of the participants and their prior IPE experiences, and then asks them to use a Likert scale of 1 to 5, strongly agree to strongly disagree, about 29 attitudinal statements with regards to their readiness to learn with others. And those 29 questions fall into 4 major subcategories, which really are essential when we're looking at students' readiness to learn together. These are teamwork and collaboration, their professional identity, their roles and responsibilities, and patient-centered care. Thanks to Dr. Mahfouz, we have done our magic analysis of data. We focused, although we had 60 participants, we actually focused only on the participants who filled in a pre and a post questionnaire. Therefore, we were limited to 35 participants' responses, and this is therefore what I'm going to be representing. We will present to you the demographics of the 35 participants, and during the analysis, all the negatively worded Ripples statements were recoded. And after all that, an overall score was summarized with means and standard deviations comparing the pre to the post using the paired t-tests. And attitudes and preferred learning formats were also summarized in frequencies, and this is the SPSS software that was used for the process. So, who were these 35 participants? You'll see here that 20 of them were pharmacists, so that's 100% of our pharmacists, and 15 of our medical students, so that's only a third. So essentially we had a 58% response rate. They're all between 20 and 24 years of age. All our pharmacists are females, and 2/3 or 3/4 of the responding medical students were males. So our pharmacists have had plenty of interprofessional learning experiences before this, but this was actually the case for a minority of our medical students. And in general, their familiarity and their use of the Ripples survey was fairly minimal. So this is really the big picture. What we've done is we've taken the mean scores of the 29 attitudinal statements, and we've looked to see whether there was any change between the respondents before and after the event. And essentially we're seeing here that there is a shift in favor of a positive change, even though this is not necessarily statistically significant. And we do want to say that with numbers being small, p-values may be less relevant. If we look at the individual items, the teamwork, professional identity, roles and responsibilities, the change itself specifically was not that great. So, in the interest of time, what I'm going to do is, because we, for the subcomponents of the survey, where there has been similar responses across the medical and pharmacy students, I'm going to show you the responses for the 35 students together. And I'm using the example of teamwork skills are essential for all students. If we look at the red and the blue, this basically corresponds with strongly agree and agree, we will see that 3/4 of the participants felt strongly in favor of teamwork being essential for students. If we look at the statement representing the relationship with other professionals, And the statement is, for small group learning to work, students need to trust and respect each other. Again, taking a look at the blue and the red together, we've got strongly agree and agree in favor of the importance of trust and respect among each other to be able to work together in small groups. With regards to negative professional identity, and the statement is, it's not beneficial for undergraduate healthcare students to learn together. I'd like you to have a look at the blue and the red, which correspond with strongly disagree and disagree. So we're glad to see that they disagree, that it is not beneficial for undergraduate health students to work together. Again, a negative, which is an important positive. And with regards to shared learning will help to clarify the nature of patients' problems. Well, the green and the brown represent agreeing and strongly agreeing. So we have a really, a uniform sort of positive attitude with regards to most of these elements of interprofessional learning. Now let's, and similarly for a relationship with patients, well, they all liked it and they all thought it was very important that they should establish trust with their patient as an important priority. What about their definition of roles and responsibilities? I've shown you this, I've divided the pharmacists and the medical students because I'd like you to have a look at the area, the light yellow area under the medicine zone, which is the uncertain zone. Interestingly enough, the medical students at the beginning of the event, prior to the event, were not sure really what their role was going to be. And afterwards, we see here the blue is pre and we see red is post. We actually see that their uncertainty diminished. In other words, the event helped them become clearer about what would be their role as interprofessional practitioners, if you like, with regards to the care of their patient. So again, a positive change. So how would they like to learn with each other? What we're seeing here is essentially that workshops and IPE events are the preferred ones. What they don't seem to be too excited about are online modules and online simulation. But there seems to be a variety of options, and these workshops seem to be something that they found interesting. Particularly, we see that with the workshop, with the IPE event, the blue is the pre and the red is the post. After the event, they seem to have enjoyed it enough to ask for more. So, finally, should it be assessed? Well, our pharmacists are quite comfortable, they're not that sure, and they haven't changed their mind, but our medical students were a bit hesitant at first, and they seem to think that yes, there's no harm in being assessed. So we have some difference of opinion there. Admitting that this is a small study, and that we could only really evaluate the students who filled the pre and the post. Therefore, really, this is more of a pilot than a larger study. However, it's helped us understand how we can perform the same study on a larger scale. Similarly, the fact is that this may be a self-select group of very, if you like, motivated students, so we're seeing a very positive response. As a pilot, I think it's helpful and it can pave way for larger studies in the future. Therefore, in conclusion, well, the first thing is that we were asked, would it be possible, would it be feasible? And the answer is yes, it was feasible. We've seen that in general, the attitudes of the learners towards readiness to learn together was favorable. And most of and the mean score of the 29 attitudinal statements improved after the activity. Our medical students' clarification about their roles and responsibilities also improved after the event. They like events, they like workshops, but we have some difference of opinion with regards to assessment. Thank you.